Hello, and thank you for being here today. My name is Jeremy Merchant, and I'm a board certified nurse practitioner and a doctorate of nursing practice candidate at Wagner College. Today, I'll be presenting on chemical hazmat training for emergency room nurses. ER nurses are the front line when patients arrive with chemical exposures. It is our ability to recognize, protect, and respond which will determine the patient's outcome, but also the safety of our staff and the hospital. By the end of this presentation, emergency room nurses will be able to state common chemical hazardous materials encountered in the emergency room, identify the health risks such as respiratory problems, cancers, organ damage, and developmental delays associated with chemical agents exposure to both patients and healthcare staff, understand appropriate use of personal protective equipment, decontamination protocols, and hospital safety protocols for hazmat incidents, ascertain current best practices in managing chemical hazardous incidents, understand the components of the hazmat acronym RAIN, recognize, avoid, isolate, and notify, and how to apply them in chemical hazmat situations. Identify a culture of safety in the emergency room through continued education in addressing chemical hazmat emergencies, and report increased confidence when managing a chemical exposure. Hazardous materials include chemical, biological, radiological, and nuclear substances that poses dangers when released. Exposures can occur anywhere. For example, industrial accidents, residential incidents, transportation crashes, natural disasters, or intentional acts of war and terrorism. The key point is that hazmat isn't only a disaster we hear about in the news. It can arrive to our emergency room at any given moment, and we must be prepared. Hazmat is just not a problem in the United States. It is a global threat. The United States reports over 12,000 to 18,000 hazmat events every year, with thousands of serious injuries. Countries like the UK, China, and Russia, and others have reported significant numbers. Our ERs must be ready for these incidents at any given time. Hazmat incidents are on a rise, with most hospital emergency rooms not ready for this kind of emergency. A significant number of incidents also involve the release of multiple chemicals, each having different and possibly dangerous interactions when combined. Dangerous materials and gases like sulfuric acid and ammonia are released into the environment, creating high health risk for patients, staff, and first responders alike. Some of the acute effects include respiratory failure, skin burns, seizures, and sudden collapse, while chronic effects include cancer, organ damage, and developmental delays. ER nurses are the first line of defense. They first encounter contaminated patients, and their decision to act within the first few minutes determines whether contamination is contained or spread across the ER. Some patients may arrive without warning. No EMS alert, just walk into triage. This unpredictability makes preparation essential. Structured hazmat training improves both knowledge and confidence among ER nurses. Without this proper training, the risk of exposure, delayed care, and facility contamination skyrockets. ER nurses play a vital role in responding to chemical incidents. However, they lack adequate support in hazmat preparation from policy and education systems. Poor preparation leads to delayed care, staff exposure, contamination of facilities, and legal risk. Evidence is encouraging and shows that an organized hazmat education increases confidence, knowledge, and readiness. This is a call to action. We need standardized education and policy support so nurses can respond safely and effectively. History provides sobering reminders. In 1000 BC, China used arsenic smoke bombs. In 1915, chlorine gas was used in World War I to cause mass suffocation. In 1995, the Tokyo Sarin subway attack killed about 14 people and injured over 5,000. This was the global wake-up call because hospitals were unprepared and no decontamination and no PPE were in place. In 2018, Syria used chlorine gas attacks to devastate entire neighborhoods. Chemical incidents continue to occur, and hospitals cannot afford to be underprepared. Chemical agents fall into different key categories. Riot control agents include tear gas and pepper spray. Industrial agents include chlorine, phosgene, ammonia, and cyanide. Blister agents, vesicants, include mustard gas and lewisite. And nerve agents include tabun, sarin, soman, and VX. Response must be agent-specific. For riot agents, response includes removal from the exposure, irrigation of eyes and skin in symptomatic treatment. For industrial agents, response includes airway management, decontamination, and specific antidotes. For blister agents, vesicants, response includes rapid decontamination, respiratory support, wound care, and pain management. And for nerve agents, response includes immediate decontamination, administration of atropine and 2-PAM, and airway management. For unknown chemical exposures, nurses must rely on rapid assessment. When a patient presents with shortness of breath, assess the pupils. If they're pinpoint, think of nerve agent or opioid and be ready to administer atropine 2-PAM or naloxone. If the pupils are normal, assess the lungs. If they're clear, think of cyanide and be ready with a cyanide kit. If the patient is wheezing, think of phosgene, chlorine, ammonia, or riot control agents and be ready to administer bronchodilators. If the patient is seizing, assess the pupils. If they're pinpoint, think of nerve agent or opioid and be ready to administer atropine 2-PAM or naloxone. If the pupils are normal, think of cyanide and be ready with a cyanide kit. If the patient presents with rashes or blisters, assess the level of pain. If the pain is sudden, think of lewisite and be ready to administer British anti-lewisite and manage their pain. If the pain is gradual, think of mustard and be ready to manage their pain. There are 4 levels of hazmat protective suits. Level A offers the highest protection. It's a fully encapsulated with self-containing breathing apparatus. It's mainly used by specialized hazmat teams for unknown or highly toxic exposures. Level B provides high respiratory protection and is used in decon zones when respiratory risk is high. Level C uses an air purifying respirator with a chemical-resistant suit. It is the most practical level for ER nurses when the contaminant is identified and the air is safe. Level D is your standard work clothing with no respiratory protection and is only safe in uncontaminated areas. Level A and B are for field hazmat teams. Level C is the most relevant for hospital ER nurses, and Level D should never be used for direct hazmat care. It should be only worn in safe zones. One of the most important safeguards for our staff is personal protective equipment, PPE. Donning PPE occurs in the cold zone, a safe, uncontaminated area. Nurses are first required to remove all personal items such as jewelry, watches, pens, and phones to prevent trapping contamination. Nurses should change into surgical scrubs if not already wearing them and wear washable footwear. Nurses should hydrate before donning PPE because PPE causes stress. Donning PPE should be in this correct sequence and always with a trained observer. Start with inner gloves, then put on the protective coverall suit and zip it up completely. Add shoe covers or integrated booties. Put on a respiratory protection, either an N95 respirator with the proper seal check or a PAPR, powered air purifying respirator. After, they should place on the hood, ensuring that it's tucked securely. They should add a face shield for full eye and mucous membrane protection. And finally, put on outer gloves that extend over the sleeves, cuffs to seal the suit. In high-risk situations, a third pair of gloves may be added to reduce contamination during removal. The observer then verifies that everything is sealed, secured, and that mobility is adequate before a nurse can enter into a warm or hot zone. Donning protects us. If we fail at this stage, we cannot safely provide care to our patients. This is an example of how a nurse should look when wearing a Level C hazmat suit. Doffing is where contamination risk is the highest. This occurs in the warm zone. Always have a trained observer present. Step 1. Before entering PPE removal, always inspect for visible contamination. If contamination is seen, wipe it down with a sandy wipe before entering. Disinfect outer gloves with Purell and let them dry. Step 2. Remove the gown and the third pair of gloves together, if triple gloved. Pull the gown away from the neck and shoulders, touching the outside only. Roll it inside out into a bundle. Peel off the third gloves with gown and discard. Inspect the remaining PPE for contamination and disinfect with Purell if needed. Disinfect the second pair of gloves with Purell. Then remove the face shield. This is done by tilting the head slightly forward. Grab the rear strap, pull over the head, and let the shield fall forward. Disinfect the gloves after the removal. After this, remove the hood. Untie or unfasten it. The observer may assist. Lean your head forward, lift off without touching hair and skin, and then disinfect the gloves again. Remove the overall and shoe covers together. This is done by tilting the head back, unzipping it completely. Roll down inside out to waist, avoiding contact between scrubs and the outer surface. Sit, roll down to the ankles, and step out into clean sheets. Pull your arms out, allowing the gloves to peel off the sleeves. Disinfect the first pair of gloves with Purell. Remove the first pair of gloves by grasping outside one glove with the opposite gloved hand and peeling it off. Slide the ungloved finger under the remaining glove and peel it off without touching the skin. Use Purell on bare hands and don clean gloves for the respirator removal. To remove the respirator, lean forward, remove the bottom strap first, then the top strap without touching the front. Disinfect the gloves. Use the same glove removal technique as above and perform a final hand hygiene with Purell. The trained observer should inspect the scrubs and disposable garments for contamination. If contaminated, alert the hazmat or site safety officer immediately. Showering is recommended if there was a high-risk exposure. Doffing protects others. It prevents contamination of clean areas and staff. When a suspected hazmat patient arrives, ER nurses are the first line of defense. The response begins with recognition. We must quickly identify warning signs such as unusual odors, powders, oily residue on skin or clothing, and cluster of patients arriving with unexplained symptoms such as respiratory distress, seizures or pinpoint pupils, rashes, or blisters. The second priority is protecting ourselves and others. This is where the RAIN protocol can be applied. Recognize, avoid, isolate, and notify. The nurse must stop the patient from entering the ER. They should keep them in a designated triage bay or outside the main facility and ensure staff are wearing at least basic PPE while awaiting the hazmat team. We want to activate the hazmat response system. We first notify the charge nurse, the physician, and the hospital incident commander. This is done by dialing 33 to activate it. Security must be needed to lock down entrances and directing patients toward the decontamination trailers. Direct EMS to bring any patients to the decon trailers or zones. Every suspected patient must be kept isolated until cleared. Do not allow other patients to enter the area until it is cleared. Then initiate decontamination. Don appropriate PPE and instruct patients to go to the decon trailer to get decontaminated. Once patients are cleared from contamination, move the patients into a designated isolation area. Start triage. This is where ER nurses will do their ABC assessments, obtain vital signs, and triage according to the level of severity of symptoms. ER nurses will be required to administer oxygen, place IV accesses, or administer antidotes as per the ER physician's discretion. ER nurses should provide continuous monitoring to these patients. ER nurses must report exposure details to physician, charge nurse, incident commander, and/or hazmat officer. Document the time of exposure, decontamination steps, and presenting signs and symptoms. If staff were to get exposed, follow the same protocol for exposed patients and send them to the decon trailer to get decontaminated. ER nurses must stay in proper PPE until the area is cleared. Follow the zone protocols. Cold is the safe zone. Warm is when PPE and doffing occur. And hot is the contaminated patient zone. Do not re-enter clean zones until decontamination and clearance is complete. As the ER nurse, your main roles are early recognition, isolation, protecting yourself and others, and proper decontamination before patient care. This is the decon trailer located in the ambulance bay outside of the ER. This decon trailer provides decon for both patients who are ambulatory and non-ambulatory. Hazmat teams will provide instructions on how this process works. This is an example of how a hazmat team will initiate decontamination by placing the patients on a stretcher and rolling them into the decon trailer, where they will get decontaminated and rolled out and be placed in a designated isolation area and be provided medical services. Chemical hazmat incidents are not rare events. They are increasing worldwide, and ERs are often the frontline point of contact. Preparedness saves lives. ER nurses who are trained and confident in hazmat response act faster, safer, and more effectively. We must push for standardized hazmat education, clear hospital policies, and an ongoing culture of safety and preparedness. To learn more about hazmat training, please attend the annual ER hazmat training sessions offered every July with our wonderful Maimonides Medical Center Emergency Medical Services. Remember, preparedness is our best defense. Thank you for listening to this presentation.